Ladies and gentlemen, welcome to the Peak Performance Podcast. I'm Coach Kyle, and this is Dr. K.
Hi, everybody. Thanks for joining us today as we talk about ozone. We're going to cover its benefits, its side effects, how to do it on yourself, how to have it done on you. We're going to talk about its price. I think that's it. Let's get into it.
Enjoy the show. Today we're talking about ozone. So we're going to jump right in, but before we jump right in, I just have to comment, Dr. K. You made me look good. So I came home after a trip down to see you, and we did something called EBOO. And unfortunately for the audience, we did a whole episode as this video episode. We were there. He was showing it all, how it worked. It was amazing. We explained it. It was thorough. And we didn't record any of it. So we have one recording of a iPhone camera with no sound. That's all we've got.
I was so sad when you told me that. I was so excited for that episode. It just means you have to come back down again in a couple months, and we're going to have to do it again.
Yeah. So, well, we record this whole procedure, and we'll probably talk about it later on the podcast, but it just didn't work with our equipment. But inflammation in my body went way down. My skin looks better. My face looks better. My hair is like so soft. So I get home and my wife goes, "You're absolutely glowing." And I was like, "It's that EBOO glow. What can I say?"
Yeah, dropping all the inflammation out of your body, you'll just, all that inflammation under your skin that you don't realize you have, it just disappears, and your veins appear, and your eyes aren't sunken in your head anymore.
Yeah, that was the biggest thing. Honestly, when I smile, you can see my eyes more. It's wild.
Wow.
So I can definitely tell I was full of toxins and needed a toxin oil change, as we called it in the podcast that you'll never hear.
Yeah.
So we will do. Yeah. We'll do it again one day. Probably next time I come down. We'll have a better setup for the audience, we promise. But until then, we're going to be talking about ozone today.
What is ozone, Kyle?
I don't know. I heard it's going away and we're all going to freeze.
Is that something with the ice age? If I breathe it in, it might kill me.
Yeah, well, that's possible too. Well, basically ozone, at its simplest, is just O3. So 3 molecules of oxygen. Correct me if I'm wrong.
You're not wrong. What do we do? Why do we care?
Well, I do know that O3 can sometimes go to O2. And oxygen is a good thing. It's kind of like that song, "Rain is a good thing," but it's oxygen. So we want to get to O2 from O3. So I think you're going to explain how we do that.
Yeah, let's talk about it. So the best way to utilize ozone is to get it into your bloodstream. Obviously, the best way to do that is to give you an IV of ozone. But if we just ran an IV of ozone to you, that probably wouldn't end the best. I'm not saying I'm not saying it's impossible. I'm just not saying it would end the best. Typically, the way we do it is we remove blood from your body, mix ozone with it, run it back into you. That's because ozone reacting with your blood is an exothermic reaction. So we just want that reaction, that heat production, to happen outside of your body instead of inside your body. There is a tangential thing called DIV, direct intravenous ozone. We don't do that here in America. But basically, you just inject ozone straight into the bloodstream very slowly. Because ozone is literally just pure O2 and O3, it can't actually cause an air embolism. It's nitrogen that causes the air embolism. If you put ozone or oxygen directly into your bloodstream, your red blood cells will just absorb it, same as in your lungs. That's why it doesn't do it.
Yeah. So ozone is a molecule, 3 molecules of oxygen, essentially.
Yep.
And then when you get ozone, basically it's a beneficial compound that it helps do things in the body. And the best way to do it is probably through an IV treatment.
Yep. We're there so far. I've been rambling, but you're right.
I just want to cover that for the layman, because you said a lot of big words. He said exothermic, and I was like, oh goodness, here we go. Sometimes I go off on the big words, but Dr. K's got us today. So basically, it's this molecule that has some kind of benefit in the body that we inject through IV. Are there other ways to get it in our body?
You can do direct injections of it with a needle and a syringe. You can apply it topically.
I've
Those
never
are
actually
really
heard of that.
topical. Oh yeah, we'll talk about topical. I love topical ozone. And then there's also rectal and vaginal ozone.
Mm-hmm. I've done the rectal ozone. I actually have a machine right over here for that. I
Oh,
got little bags, and you just fill them up, and you go, whoop,
yep.
you hold it. It's
Hmm.
not a great experience, but it
It
does seem to
works.
have beneficial effects when I can't get down there to see you for an IV.
Yeah. And then actually, there's also nasal insufflation. You can put it in your ears. I know dentists use it for mouth stuff. I've used it for mouth stuff on myself. So basically, if a hole exists in your body, you can put ozone into it.
So it's a molecule, but how does it help us? How does giving us that extra O from O2 to
Yeah.
O3? How does that do us any good?
So there's a few different things that ozone does in the body, and I'm going to speak kind of generally. I'm not going to bore you guys with the exact science of it, but really the main things it does are decreases free radicals in your body. Do we know what free radicals are?
Yeah, they're just like a little. I want to say, man, it's been so long. It's
They're
a negatively charged ion.
Yeah, they're ions that bounce around their
Yeah.
bodies, and they're at a microscopic level, like they're the DNA
Hmm.
size level. And the same reason that we take antioxidants like blueberries and wine is to reduce our free radical burden. Ozone does the same thing, but does it at a way higher concentration than wine or blueberry. We're talking
Yeah.
hundreds, thousands.
Are they
And so
negatively
what
or
that
positively
does,
charged?
I'm sorry.
Are the free radicals negatively or positively charged? That's what I can't remember.
So it's O3 minus. When
Yeah. So
ozone reacts with blood, it makes a particle called ozonides, which are O3 minus.
okay. So the free radicals are positively charged, and so
Yes,
ozone
free
has a
radicals are
strong
positive.
negative. Yeah, it has a
Um,
strong negative charge, which can
yes,
suck all those free radical inflammation causing things out of you. They can
correct.
grow.
Yep.
Actually, I guess it doesn't suck them out. It forms with them to make a
Correct.
neutrally charged atom.
Yeah. So ozone, when you make ozone, it carries a charge, and then when it reacts with your blood, it becomes an O3 minus. Then it binds to free radicals in your body, becomes O3. O3 doesn't like to be stable. It doesn't like to be not charged in any way or the other. And we're going back to like high school chemistry, so it doesn't really matter that much. But basically, it ends up getting sucked into your mitochondria pretty quickly. And for those of you that remember high school biology, the Krebs cycle, Kreb, Krebs cycle, that's basically the fancy name for how mitochondria, which is the powerhouse of the cell, the thing that makes all of our energy, it's how it makes the energy. It normally takes O2 and splits into O and O, and you get two chains of energy out of that called ATP. When you give them O3, through that same process, you actually get a third chain of energy basically for free. So effectively, it's a 33% boost to the cells that manage to get hit with an ozone particle.
So, correct me if I'm wrong, but if you get this energy boost from it, and this is one of the benefits, do you want to hit as many cells as you possibly can?
Correct. Yeah, ozone is all about the quantity of blood you treat. The more blood you treat, the bigger the effects of ozone are.
Okay. Yeah, that makes sense. So let's keep circling back to benefits. So it clears out free radicals.
Yep.
It increases your energy through the Krebs cycle with the extra ATP molecule.
Correct.
And then, like, what do people see on a more tangible level, less biological?
Yeah. So the next thing is it's really anti-inflammatory. So it just calms down inflammation in your body, like that thing we mentioned in the beginning of the podcast. And we were talking about EBOO specifically, and we're going to explain all the different types of ozone. EBOO is just basically the most powerful one. But as we reduce inflammation, that's a noticeable benefit. You'll just, all the things that Kyle mentioned, you can see. That's the next benefit. The next benefit, and this one's more a biological level, is it can actually stimulate your immune system to function higher. It can turn what are called Th1 cells into what are called Th2 cells. Basically, it's activating your dormant immune system to fight infections stronger or harder.
We've got inflammation, clearing up free radicals. We've got improved immune system, and we've got more energy. Um,
Yep.
so this is not something you see that will like maybe athletes could use to increase their performance, or could they?
Oh yeah, absolutely. So the last benefit is hyperoxygenation. So if you think about the way a red blood cell travels through the body, I wish I had a white screen like I like to draw on things, but basically a red blood cell is traveling through the bloodstream. It's got oxygen basically on its back, and as it travels through, that oxygen gets plucked off and replaced with a carbon dioxide. But if we put an O3 on that red blood cell, it's going to travel further because it has one extra one. So it's going to travel further before it runs empty. So basically, we're going to bring more oxygen to normally less oxygenated places like your eyes, your kidneys, your heart. Things that are last in line are now going to be first in line. And so when you hyperoxygenate your tissue, it can repair and rebuild faster. And plus, you're going to have noticeable effects. I have people that tell me that they can see better for a few hours after doing ozone. More energy is definitely a noticeable benefit. And so we have professional athletes. They'll come do ozone after hard workouts or before big games because they notice it does provide an edge for them when playing. And, ozone is fully allowed currently it's fully allowed by all major professional athletic associations. So that's
Why is it under the radar for athletic performance enhancing?
I think they know about. It's just how do you regulate oxygen,
You can't breathe deep. Not allowed in your sport.
right? So I think that's really why
Yeah.
it's allowed. Is one, you can't test for it, and
Yeah.
two, what are you going to say? You can't be above 100% oxygen saturation. So what are you going to say?
There's no way to show that they actually did it unless they
Yeah.
tracked them. But
Mm-hmm.
I mean, regardless, it's a health benefiting
Yeah.
longevity type of treatment anyway. So I mean, those are the kind of things that we probably want our athletes participating in anyway, given the strain of their job
Yep.
and effect on their lives. Um, Unlike many performance enhancing substances are the opposite of that. Take away from your longevity. There are quite a few that do give longevity benefits, but ozone is one of those that's good for both.
Yep. Absolutely. Most of
So tell
those.
me about.
Oh, I was just gonna say most of those performance enhancing things they're borrowing from tomorrow, basically. Um, Whereas ozone is just amplifying throughout.
Yeah, yeah, that makes sense. So tell me about ozone and the side effects. So are there any side effects? Are we going to like just instantly feel amazing, or is there like a detox or something like that
Yeah.
happens? Because it seems like it is somewhat of a poisonous molecule to things in high concentrations, like mold, because it can be used to remediate mold.
Yeah. So obviously the number one side effect, don't breathe in ozone. It is a lung irritant. It's actually not poisonous. So I want to clarify this for everyone because I get this question often. So the reason that ozone is associated with being poisonous is because in the environment, when they say ozone levels are high, people associate that as it being toxic, like on the Weather Channel. Really, what it is, ozone is the easiest thing to measure in our environment. It is a byproduct of all those other toxic things being produced in our environment, but those other things are more costly and harder to measure. So they found that they can just measure ozone levels and then know that those other things are also high.
So
Um,
you're talking like when chemicals are being made or factories are making stuff, they're pumping stuff out into the atmosphere, and one of the byproducts is ozone, but they can't really measure the other chemicals as well or as cheaply, so they just measure the ozone.
Correct.
Huh. I didn't know that. There you go. See, folks, I'm learning here too today.
Yeah, so that's where ozone got its bad name, and now unfortunately it's stuck with it.
It is
Um,
toxic to certain organisms, though. So, like I mentioned, it will actually kill mold. It's one of the very few things that will actually kill mold. Like bleach won't do it. Hydrogen peroxide is another thing that'll kill it. But it's not poisonous to us. Can it kill us?
um, I don't know how you would be able to, honestly. I guess if you pumped a ton of it straight into an IV very quickly, yes, but other than that, not really. I mean, I guess
Maybe
if
if you
you
breathe a ton of it in.
if you what?
like breathed a ton of it in, like pure
Yeah, I guess if
ozone.
you sat in a room full of ozone for like 30 minutes, it might crisp your lungs, but I mean, you'd be so miserable in that room. I don't think you'd be able to sit in that room.
Just leave.
Yeah. Um, so
Okay, so it's not really dangerous.
no, but side effects. So there's three groups of people when it comes to ozone treatments. We're talking IV to start with. There's people that feel better immediately. There's people that feel worse immediately, and then there's people that feel nothing. So the people that feel better immediately, usually those are pretty healthy people, and when we give them ozone, they get that extra energy benefit. They get that hyperoxygenation benefit, and they just feel good. Their body's healing. Things are happy. We get to move on. They'll sometimes do more of them just because it makes them feel good. Then there's people that feel worse. Typically, this is known as called a Herxheimer reaction. And Herxheimer reaction, it is a specific definition of flu-like symptoms in response to a die-off effect of a infection or toxin. Was that simple enough definition?
Yeah, I think that was pretty good.
Okay.
Basically, you're detoxing and you feel bad.
Yep. So Herxheimer is a specific group of symptoms, and then there's a more broad category of detox effects. And I typically just call those an exacerbation of your symptoms. So whatever you feel, you just feel worse. If you have fatigue, you have more fatigue, you have brain fog, more brain fog, and etc. And what happens is the ozone's killing whatever it's killing in such a high quantity concentration that your body, it's basically its dumping mechanisms for removing that toxin are just overwhelmed, and so it starts to build up in your body. And then
And then
there's
your
the
body has to clear it. And
I'm
that's
sorry.
what you're feeling. And then your body
Yeah,
has to clear it, and that's why you're feeling it.
yeah, you're getting bottlenecked on your detox pathways.
Gotcha.
And then there's the people that feel nothing. Now, these are the most interesting people, right? Because these are the ones that need more ozone treatments, and it's really hard to explain to them why. Because pretty much one out of every three people I get, they're like, "Oh, I didn't feel much from that. I don't want to do it anymore." I'm like, but if you're healthy, you should feel good from ozone. That's what's supposed to happen. It basically what I'm hearing is that it's working on something. We don't know what it's working on. It's being targeted towards something. So you're not getting any extra benefits, but whatever it's working on isn't bad enough for you to detox, bottleneck. You're keeping up with whatever it's doing, but who knows what it's doing.
Yeah. So those people, if they kept doing it, most likely would get to the point where they would feel good afterwards.
Yeah, some of my patients actually do listen to me, and when they feel nothing, they'll actually keep going. And once we've done enough, and enough varies. Sometimes enough is like one or two more. Sometimes enough is like 10 more. But once we do enough, they will eventually start to feel better.
Yeah. So my journey with this was when I started with you, I had crazy like Herxheimer reactions, huge detox reactions. I felt like trash afterwards. And it could have also been that it was paired with chelation and like extreme detox weekends. I would fly down to see Dr. K and I would stay for a handful of days and we would do like chelation alternating with ozone. So it was just a lot on my body, but I didn't feel great afterwards. But now, as I've gotten healthy and as I've gotten detoxed, now I go do an ozone treatment. I feel like amazing. And like pretty soon after, like I'm in the car on the way back and I'm feeling good.
Yeah, and that's really how it should be. My healthier people, they feel better sitting in a chair.
There we go. So I got one more step to make.
There you go. Yeah, that's the ultimate goal.
Yeah, I was still a little woozy when I was sitting in a chair. Maybe it was just the sight of so much blood. I used to pass out when I saw my own blood. Not anymore, thanks to exposure therapy from you. Um,
You're welcome. Okay, so
okay,
we talked about side effects.
yep.
We talked about benefits in the body. We talked about side effects. What's next?
So we talked about how to administer, but I'd like to go into a bit more detail how to administer in each different one.
Yeah.
So we started with IV, and I'll let you go into that, but I just want to quickly explain rectal insufflation. So basically, rectal insufflation is the most popular way to administer ozone at home. You can buy an ozone generator for $600 to $1,000.
Not
You
anymore.
can get not anymore. Are they more expensive now?
The real companies that you can actually trust are like 3,000 now.
Ooh, they got expensive. Sorry, guys.
Yeah.
COVID supply chain issues, jacking the price up on everything.
Yeah.
Still, but anyway, you can buy these things at home, and then you either get a medical grade oxygen regulator or you get a industrial grade oxygen regulator, and you hook it up. The generator makes ozone from your oxygen. And for you guys who are wondering about medical versus industrial grade, it is nearly identical. The quality and purity.
Actually,
go ahead.
industrial welding grade is actually more pure than medical, because if there's one single contaminant, you go boom.
Look at that. So yeah, I didn't know that. I'm learning all kinds of stuff on this podcast today, guys. so industrial grade, that's what I have. I mean, I buy it from like a medical supply station, and I don't tell them what I'm using it for because they probably wouldn't sell it to me if I did. But basically, you get the oxygen tank, you hook it up to the generator, you hook up a bag with a little spout on it, fill up the bag with ozone, click the spout, lock it off, you stick it up your butt, squeeze the bag out, and then you hold it there for about 30 seconds, and then you're good to go. And you get a lot of the same benefits, but it's not nearly as effective or strong as an IV.
Yeah,
Is that
so
correct?
they say it takes roughly 3 rectal treatments to equal 1 simple ozone. And I'm going to explain what I mean by simple ozone in a second. But it's roughly 3 to 1 to the starting level of IV ozone.
Yeah. So, I mean, in the grand scheme of things, doing a rectal ozone treatment is a good option if you don't have access to a doctor that provides this, or cost considerations are a main thing for you. But going to do one ozone treatment in Dr. K's office, especially as EBOO, is much like doing probably 50 or 60 rectal insufflations.
What I've learned is you really can't compare EBOO to regular IV ozone or rectal anymore. It's just so different. There's just no comparison level anymore.
Okay, so the moral of the story is an IV is way more effective because you get exposed to way more ozone. You get more treatment of ozone.
Correct.
And you can only take so much rectally before you start having weird side effects. So don't
Yeah.
do more than one bag at a time.
Yeah. So ozone. So the way you calculate strength of ozone is you multiply its volume, the amount of ozone you're doing, multiplied by its gamma, and gamma is just the strength of ozone, which is measured as micrograms per milliliter. Not relevant. It's just anywhere from 1 to, we stop at 70 because that's about your safe level. We technically up to 100. And then there's a third factor that's often not talked about. It's your diffusion factor. Basically, how well the ozone can interact with the surface. And that's the main reason why IV is better than any of the insufflations. It just diffuses better into your blood than it does through your mucosal tissue, mucosal being like a rectal tissue.
So the diffusion factor, Dr. K, is how effectively that ozone can get into the bloodstream or onto the red blood cells. Or is it the same thing, really?
That's basically the same thing. Basically, you need to get it into your bloodstream, and once it's in your bloodstream, it's going to bind to red blood cells instantly.
Okay. So it can't travel through the mucosal layer as effectively as it can if you just put it right into the blood.
Correct. And then, as long as we're on rectal, let's get into ear, nose, mouth insufflation same time. So the trick to doing ear, let's start with ear. The trick to doing ear is you have to wet your ears first because moistening your ears actually increases your diffusion factor. But basically, they sell these as well. Once you buy the ozone generator, you can buy accessories for it. One of the accessories is a stethoscope. And then you put the stethoscope in your ear, you turn on your ozone machine, and once again, your gamma could be anywhere between 1 and 70 is your safe limit. And then you sit there for 15 minutes and let it crank into your ears. I typically only use ear insufflation for ear or sinus issues. I know doctors that all they have is an ear insufflation machine, and they swear that it works, for treating whole body issues. I just find it's a lot slower. So it's kind of like, what are we really doing here, guys? So but for ear and stuff, it works great. The one caution, if they have a ruptured eardrum, do not do it. They will feel so terrible, so miserable, so dizzy.
Yeah. How do you know if you have a ruptured eardrum?
They know, honestly.
You put it on, you're like, ow, it hurts. And then you're like, okay.
No, like that. They'll know in advance. because one, it hurts when it happens. Two, your hearing perception changes a little bit. If you're worried
Yeah.
about it, have your doctor, most doctors have an ear looker thing in their office. Just have them take a peek in your ears before you do it if you're
Yeah.
really worried.
Is that what they're looking for when I go to the doctor every time? They get that little light thing out?
That's one of the things too. They're looking for like ear infections and stuff. Check
Gotcha.
out
So it can knock out. So it
Sorry?
can knock out an ear infection. Ozone in the ears.
I've used it for that. It works quite well. Yeah.
I've heard a lot of different stories from a lot of different doctors and biohackers like me that have used it successfully for ear infections also. And it seems to be like what I've heard is 1 to 2 treatments, and then really bad ones need like 3.
Yeah. And we're talking, day 1, day 2, day 3. We're not talking like, 1 a week, because at that point, just take antibiotics.
Yeah. Okay, so you did ear. We
We
got
did ear.
nose.
Nose. So there's 2 ways to do nose. There's the meaner way that I do on my patients, and then there's the nicer way. I find the meaner way just works faster, honestly. So the nicer way, you run it through a ozone bubbler. Once again, an accessory buy to your home ozone generator. But basically, it's the ozone feeds into this like glass device that has water in it, bubbles through the water. That takes basically the sting out of the ozone, and then you breathe it in.
So the water flows, the ozone flows through it, and then you breathe in the vapor, or you try to like breathe in the water.
No, you breathe in the vapor.
Okay.
Because
Is it hot?
No, it's not hot. It's whatever temperature your water is. And then it's not so much a lung irritant anymore. I guess technically breathing enough in it still could be, but it's so reduced that doing a 5 to 10 minute treatment of it won't irritate your lungs. And then there's the other way I do it, which is I fill up a big syringe with ozone, and I won't go higher than 20 gamma. And you hold your breath, shoot it straight up your nose. You can if you do enough, you'll actually fill into the sinuses, and then you hold your breath for 30 seconds and then breathe out through your nose, and that works great. I use that for sinus issues, even allergies. It'll pause allergies in people for a few weeks.
Oh wow! So you don't actually.
Go ahead.
You don't actually like inject it there. You just spray it up, right?
Correct. Yeah. It's not going through the skin. It's just, you take a syringe and straight up the nose.
Okay.
And so their nose will run anywhere from 20 minutes to a few hours after. And it's pretty burny for the first like 20 minutes. You don't want to go too high because you'll actually burn nasal tissue if you go too high. So you keep it at low gamma. And then afterwards, it works quite well. It's kind of sterilizing all that tissue.
I want to try this next time I'm down to see you.
Well, we'll see. It's not a fun experience. Usually, when people that do it are really desperate.
Well, and me.
Sure. And then
I gotta experience all the things.
Sure. And then the last option is oral. So you can inject it. So I know dentists that inject it into, if they're doing a, tooth repair, they'll inject it into the gums or inject it into the tooth repair. What that does, if you inject into tooth repair, cavity, root canal, implant, whatever, it'll sterilize all the tissues. So you significantly reduce your possibility of infection. The other option, I've done gum injections. It can help with gum inflammation, gum recession. This is direct injections into the gums, but I've seen it reduce inflammation. I've seen it actually regrow gums in certain circumstances.
Wow. Do you know what causes that?
What?
The regrowth effect.
Well, I think it's gingivitis is recession, right? Gingivitis is just inflammation in the gums. Usually it's one of a couple of things. Could be genetic, could be inflammation, could be infectious. So if you reduce the infectious and the inflammation, you're covering 2/3 of the causes, and then 2/3 of the time it will regrow.
Wild. I had the opposite of that when I was young. The doctor said I might have to go get a gum harvesting surgery because I had too many gums. It was like going up my teeth.
Oh.
And they said if it goes any further, they're like, you're at the line. We're going to have to take you in from surgery. Cut your gums off. I was like, I don't want to do that. Yeah. It didn't. It stopped, thank goodness. But it was scary.
Yeah, that's like, to me, that sounds like one of those things that you do it, and then 10 years later, you're dealing with gum recession, and you're like, what?
Yeah. Okay, so you mentioned injecting directly into the gums.
Yep.
And I can speak to this a little bit because you did this on me to help clear an infection, correct? Is that what we were going after? A cavitation?
You had a cavitation, yes. And that's a whole different beast. Let's not even get the cavitations right now. Let's talk about IV ozone because those are a whole different crazy discussion.
Okay. We'll get to that later. But anyway, he injected my gums, and it really was not painful. I
No.
thought it was going to be painful, but it really, honestly, it was hardly anything.
Yeah, I numb you first, just like the dentist numbs you, so you don't feel much after the numbing. And then, it depends what we're doing. The things you mentioned, cavitations, some people do find it incredibly painful. Most people don't feel much, though.
Okay.
Okay.
So we got ear, nose, we got gums, mouth, we've got rectal insufflation, and now we're going to either topical or IV. You pick our next destination.
I was going to say, I could keep distracting. I remember another one of bladder.
Huh.
You can actually, you could put a Foley catheter in and inject ozone straight into the bladder. Bladder cystitis, it's really quite good for that. Chronic inflammation, infection in the bladder. You put ozone straight up there, and it works quite well.
I have heard of a doctor that does. It's much scarier than the way you were offering to do something like it. But he takes a giant needle
Straight into the bladder.
Yep, and he goes into the prostate.
Yep.
And injects it with like methylene blue, ozone, and then I think he mixes like a little bit of like exosomes or something in there. I don't know what else he does. But apparently it's extremely painful.
That doesn't sound pleasant. It works. To be fair, it works. It's just not pleasant.
Yeah.
Okay, now let's get into IV. Let's stop teasing it. Okay, so IV, like we mentioned, IV is all about the strength multiplied by the volume multiplied by the diffusion factor. But the way you increase the amount of ozone that you can apply is you increase the quantity of blood that you are removing to treat. So the base one is, there's a few levels. So let me explain the levels first. There's simple or minor autohemotherapy. This is 60 to 100 cc's of blood. Take it out into a bag, mix it with blood, run it back in. There's major autohemotherapy. This is 200 cc's of blood to pull out into a bag, mix it with ozone, run it back in. There is multi-pass or 10-pass. This is 200 cc's of blood per pass. It can be done up to 10 times, just into a glass bottle and back into. And then there's EBOO. And EBOO is extracorporeal blood oxygenation and ozonation, or ozone dialysis is its generic name. So let's start with simple. Simple, we're going to take out 60 to 100 cc's of blood. We're going to double whatever amount of blood we take out, we're going to double it. And that's the amount of ozone we're putting in. This process takes about 20, 30 minutes just for it to drip back in. There's no pressure on this. So I put mine in saline to keep it from clotting. Plus it adds a little bit more surface area for the ozone to bind with. Because ozone, you can also do hyperozonated saline infusions where you just take a bag of saline, put ozone into it, and drip it back in. If you can't get blood out of someone, there's an okay way to do it. Not quite the same diffusion factor. But anyway, so we drip that into you. The next is major autohemotherapy. So this is the most common one in America right now. It is a big bag like this. They usually put it on the floor. Some fancier people have a vacuum for it. The blood runs out, it fills this bag. It takes like 30 minutes to fill this bag. They mix ozone with it, they run it back into you. So it takes about 45 minutes per pass. They could do up to 3 passes with it. So if you're doing 3 passes, you're sitting there for like almost 2 hours. So it's quite a process. It works really well, but it's quite a process. The next one is multi-pass. Like I mentioned, it's 200 cc's of blood per pass, and you could do a pass in like 3 to 5 minutes depending on your blood flow. So even 10 passes, you're done in like 50 minutes. So it is superior to major autohemotherapy. It's not as popular. Really, there's only 2 companies that make a multi-pass machine. One is a German machine called Zotzmann and Stahl, or new name is Aqua Pro, and then I forget the other American company's name. This is what I have in my office, and up until I got an EBOO, that's the bulk of what I did was the multi-pass.
So the multi-pass, a lot of doctors will offer ozone, but don't quite do the multi-pass because of how labor intensive it is, correct?
You're attacked. So all the other ones, you pretty much turn it on, walk away, come back in a bit, do something else, and walk away again. Multipass, you are glued to this bottle for like an hour.
The doctor is glued to this bottle. The patient's
Yeah.
glued to the chair no matter what they're doing.
Yes.
Yeah.
So, I'm
So
constantly interacting with the bottle. You have to keep swirling it so it doesn't clot. There's a pump, there's a vacuum that you have to keep playing with to maintain your pressures.
yeah, there's a doctor here in Greenville that I was visiting, and they switched from multipass to the major that you were mentioning just because they administer it via nurses, and they couldn't figure out how to train the nurses effectively to do the difficult multipass, so they wanted the more simple major, and it just
Yeah.
worked for them. But the
Multipass.
patients were there for a long time. I mean, I would
Yeah.
come in, I'd get my IV treatment, I'd be gone, and the patient was there the whole time.
Mm-hmm. Yeah, multipass, it probably took me about 6 months before I was comfortable with it. Now I've done, I don't know, well over 1,000 treatments with it. I'm pretty comfortable with it now, but it takes a while to get used to it just because it's a lot of troubleshooting. I always put it like this, you can teach a monkey how to run it. If everything's going really well, it's just you click 2 buttons interchangeably. But if something goes wrong, then you're sitting there trying to figure out where it's clotted, what's wrong, why isn't it flowing?
So 10, you said 10 pass. Do
Yep.
people start at 10 pass, or do they work up, or
No,
like
so
how,
we
how
always
does it
work
look?
well. This is more ozone. Unless you've done EBOO treatments, and EBOO is still a little bit different. Unless you've done multi-passes before, really, you have to work your way up just because it's so much ozone. You've never experienced this much before, even if you've done major autohemotherapy. So you can definitely have detox reactions to it. So we always go 3 passes, then 5 passes, then 8 passes, then 10 passes. And then most people stop at 10 passes. I do have some people that if they've done enough, like you, Kyle, I will go above. I think the most you've done is 17, which was probably a mistake for you at that time. It's too much.
That was rough. I felt really bad after that.
Yeah.
I don't know if like everything was dying off, but it was not a good day.
Yeah, you heard, I think what happened was you heard one of my other patients had done like 16 or 17 and you wanted to do it, but
Yeah.
he had done like 10 times as many as you have.
For the record, ladies and gentlemen, Dr. K is not experimenting on me. I am coming to him asking for these things, and he is doing it
Begrudgingly.
somewhat begrudgingly. Yeah. So I'm pushing the limits, and he's kind of being my guide to how safely I can push the limits on things.
Yeah, because I
This is a
figure,
good time to say that I'm not a doctor and Dr. K is a doctor, but we are not giving any medical advice. We are simply educating. So if you would like to receive any of these treatments, please consult with your medical provider. Thank you.
so yeah, I figure he's gonna do things anyway. At least I can keep him from getting hurt while he's doing them.
Yeah. Because, honestly, this is terrible. But if Dr. K wouldn't do it for me, I'd probably go find someone else that would. And then how sketchy is that guy? So Dr. K might as well do it and oversee the process to make sure I stay safe.
Yeah, because I will. If it's too much, I just won't let him do it. Like that time he tried to do 200 milligrams of methylene blue.
Oh, yeah.
I gave
Yeah.
you, I
The
think,
IV.
130, and you were miserable.
Oh, I was, I puked in your trash can.
Yeah, you did. Imagine if you'd done 200.
Man. Okay, so you can go up to, safely, larger people who have done a lot of multipass can probably go up to around 13, 14, 15 passes, but it's very rare to go over 10.
Correct.
Okay.
Um,
So usually 10 will get you where you want to go with benefits as well anyway, really?
yeah, pretty much. It's diminishing returns once you get above 10, honestly. Because at that
Yeah.
point, you treated 2,000 milliliters, about 2 liters of your blood. Most people have between 5 and 6 liters. So you're treating about a third of your blood volume at that point. That's pretty good for one session.
Okay, gotcha. And then you keep saying this thing that sounds like a large bird, EBOO. It's not an emu, folks. It's EBOO, corporeal blood oxygenation and ozonation, which we've mentioned before, but it means basically we're going to take the blood out. We're going to hit it with ozone, put it through a filter, hit it with ozone, put it through ultraviolet light and LED, and then put it back in. Is that the simplest explanation of that?
You missed one step, which was removal of inflammatory fluid waste, but that's pretty much it.
Yeah.
So
Okay.
for the record, this is the episode that we tried to record and failed. So we will upload one in the next few months once Kyle gets back down. But yeah, EBOO, it's a 50-minute treatment. We hook an IV into one arm and then into the other arm. And so it's a continuous loop. So we pull blood out of one arm. It runs through a pump, which, moves all your blood, hits our filter. It's actually a dialysis filter. So it can actually filter solid waste material. Ozone comes down from the top as blood travels up, comes out, runs under our ultraviolet light, and then back into the patient. Runs continuously for 50 minutes, so it's a constant loop. You can treat anywhere from if you really push it, you'd probably get close to 4 liters of blood. So anywhere from 1/3 to 2/3 of your total blood volume in that 50 minutes. So this is where
this is the most. This is the
this
most
yeah,
exposure you can get to ozone.
by far. So the big thing is, so I kept talking about diffusion factor, and the reason no one's ever really talked about diffusion factor before is it hasn't really mattered before. So most of those other ozone treatments, we're talking about a pool of ozone hitting a pool of blood, and they meet in the middle, and whatever diffuses, ozone rises to the top because it's a gas, sits above the blood, and that's pretty much it. With EBOO, that filter, so the filter, it's about this big, it's about a foot tall and like 2 inches in diameter, but it has 1.5 square meters of surface area in it, which is massive. I don't know how many feet 1.5 meters is. Let me Google it. That's about 5 by 5 feet of surface area, which is huge. And so your blood is getting spread out really, really thinly. And so you have a massive diffusion factor. So my best estimate, I'm sure there are people out there that will disagree with me, but my best estimate is your diffusion factor for multipass or major or whatever is probably about like 0.1, to 0.2 at best. Whereas with EBOO, we're probably hitting a diffusion factor of 0.9. And so even though EBOO runs at a lower gamma, your diffusion factor is so high that you're getting way more into your bloodstream. Along with that, the inflammatory waste I mentioned. So I put it like this: the more sick someone is, the more inflamed they are. And the more inflamed you are, the more water you retain, if that makes sense. And so when you take that inflamed blood and you run it against a pressurized gradient, which that filter, because it's having ozone fed into it all the time, is pressurized. When you run the inflamed blood through a pressurized gradient, you're going to strip out that inflammatory fluid. And we just collect all the bucket at the bottom so you can see how much came at you. So that's really the bigger 2 benefits. And that's why you can't compare EBOO to the other ozone treatments. It's the 2 big things. It's the filter, so you're removing solid waste material, things like heavy metals and molds and viruses and bacteria and fungi and whatever else is in your bloodstream that shouldn't be. And then the other part of it is removing all that inflammatory fluid, which you don't do with the other ozone treatments.
Gotcha. So it's I think we said this on our other podcast that won't air, but it's like an oil change for your body. Essentially, we're getting rid of all of the bad stuff, including solid, and the ozone is actually working on infections and other things that aren't necessarily solid and wouldn't be trapped in the filter, pulling out the inflammatory waste, and then good, clean, healthy blood is coming back in.
Correct. So in my experience, I have done, I don't know how many now. We do about 30 EBOOs a month in my office, between 20 and 30, most often 30. And which, as I'm hearing now, is, I went to an EBOO conference a few months ago, and I was like, oh, great, I have so many questions because I built my own machine. I bought all the individual parts and then, kind of combined them with some help from some friends. So I went out, and this conference was sponsored by one of the commercial manufacturers. There's 3 or 4 different commercial generators. So I went out there with a bunch of questions like, oh, hopefully, people have done more EBOOs than me and will have answers to my questions. No one has answers. Most people have done maybe 30 EBOOs, period. The only people that I know have done more, it's one guy out in California. And then one of the trainers for the company, he's overseen like 700 or 800 treatments. But really, EBOO,
so you've done a few hundred.
It's what?
So you've done a few hundred of them.
I've done, in October, I had done 300. So now November, December, January, February, I'm probably over 400 now.
Nice.
And so really, the reason I was rambling on about that is my biggest question was, what is the fluid? And why is mine clear? Why are some people's foamy? Why are some people's yellow or red? So when we were building ours, we did some testing, and some of the testing was done by a doctor friend of mine out in a different country that I won't mention because ozone is frowned upon out there. So he was finding if this waste fluid wasn't clear, it was usually hemolyzed blood. Your waste fluid should be clear after EBOO. And I know there's doctors out there that will disagree with me, but show me I'm wrong, honestly. It's hemolyzed blood, which is not a good thing. You should have clear waste fluid. And so as far as I can figure, it's basically just water with some inflammatory proteins and maybe some like electrolytes, but there shouldn't really be much else in there.
Okay. I heard of a doctor who out in California who tested the fluid, and he said he found all kinds of like inflammatory things, like some heavy metals and some infection stuff, and just things that cause inflammation.
Absolutely. But that's all microscopic, so it shouldn't change the color of your fluid.
Yeah, that makes sense. So you mentioned that the more inflamed you are, the more water your body holds, the more fluid you hold, and that comes off in the fluid bucket, basically when you're doing an EBOO. But when I did my EBOO, I had a little bit of fluid, like the bottom third of the bucket. But I peed like 10 times that day. I was like always peeing. And I literally lost like 2 pounds of water weight like that day. Was that also inflammation that was like clearing out?
So they've started doing studies. And I don't know the conclusion of this study. I just heard about it in the middle of it. But basically, they were testing people with reduced kidney function. The way you measure that is you look at your EGFR. And so they'd get their baseline EGFR and they would do an EBOO a week, and they would get their EGFR every week. And they're finding that every week the EGFR was actually climbing. And climbing is a good thing. The higher that number is, the better kidneys function. So yeah, EBOO, it basically reduces the burden on your kidneys, I guess, for an hour. And so it helps them do whatever they need to do, and then they just function better afterwards. One of the cooler stories I had a patient come in, and she may be listening to this. I had a patient come in, and she had issues urinating for months. She really couldn't get a solid stream, which is extremely unusual in a female, right? We did an EBOO on her, and she goes to the bathroom right after, and she said that was the first solid stream she had in months. And it lasted like 4 or 5 days for her. So she came in again next week, and we did it again. And again, it lasted like a week for her. So it's really super interesting why that is.
It's probably just so much toxic burden on the kidneys that it gave it that chance to kind of regenerate and catch up and function properly. Or maybe it made the kidneys themselves and the whole system less inflamed, so it just flowed better.
Something.
Wow. Okay. So the main types of IV ozone, and correct me if I have any of these wrong: simple, which is a small amount of blood; major, which is a larger amount of blood, up to 3 passes, takes a long time; multi-pass, which is a medium amount of blood, but you do it 10 times; and then EBOO, which is a continuous amount of blood through a filter.
Correct.
Essentially. Okay. Correct. So so someone comes in, I'm coming into your office. I want to do ozone. I heard your podcast. I heard the benefits. What should I do?
So that's honestly the hardest question. Really, unfortunately, it comes down to budget. Just because ozone IV, it's not cheap. And so I put it like this: if everything was free, everyone would just do EBOOs all the time. Just because I found they're so much better. You can't compare. You could do as many multi-passes or majors as you want. You're still not going to compare it to one EBOO. Just because you're not removing things. You're relying on your body. If you have, 2 665 MTHFR mutations, your detox burden is so reduced that, you could do ozones till you're blue in the face, and you're not going to eliminate everything. Whereas with EBOO, it's bypassing your body, just literally removing it for you. So, we have a conversation about kind of what your goals of treatment are. Why are we doing ozone? And then we kind of have to tailor it to you. And it's kind of how it goes.
So price-wise, I've seen prices all over the scale for ozone,
Yep.
up and down, left and right for all the different types. But I mean, do you mind giving us like ranges of what you've
Yeah.
seen for the different levels?
Yeah, so every year or two, we actually try and look at local and national averages of prices to kind of make sure that we're staying competitive. So simple ozone seems to range between $200 and $300. That includes the ultraviolet light. So range between 200 and 300, or without between like 150 and 225. Major, I forget. We don't do major, so I don't know its price off the top of my head. I don't know if you know, Kyle.
I've heard anywhere from 5 to 1,500 for 3 rounds of it.
For 3 rounds,
For three
three
rounds,
three
yeah,
passes or 3 treatments.
three passes,
Okay.
yeah.
So 500
So
per
it
pack, basically.
roughly, yeah, that's
Okay.
kind of what I've heard. It varies depending on where you are and how expensive the doctor you're seeing, and definitely the city you're in.
Gotcha. Multi-pass. This one's harder to compare just because there's not so many of them. We start at 365 and go up to 880 for 10 passes, including the light. So that's kind of the range for it. And, I've seen up to 1,200 seems to be the highest I've seen. Someone out there may be
Mhm.
charging more, I don't know. California, I wouldn't be surprised if it's more expensive just because everything's more expensive.
Yeah,
And then EBOO. As far as I know, we currently have the cheapest price in the country at $1,000, including the ultraviolet light. Um, and then the highest I've seen is 2,700 for one treatment.
yeah. I think I've seen $900, but I'm pretty sure it was a introductory special from a doctor who just got the machine.
That would make
So
sense, trying to get people in.
yeah. So, but I have seen a lot of 1,500s and 2,000s, especially in the major cities. That seems
Yeah.
to be the kind of going rate in the major cities.
Yep.
Um, so, like you said, it's really what it comes down to budget. Like if you can swing EBOO, you should
Yep.
just do EBOO.
Yep.
Or even if you're thinking about like maybe a good approach would be save your money, get an EBOO and maybe an at home rectal generator. So
Yep.
that way you can get a really strong first session and then kind of a maintenance with that home.
I would rather people do one EBOO treatment than 3 or 4 simple ozones, honestly.
Yeah, just has that much more bang for the buck.
Yep.
Okay, so we talked about IV. I think we're pretty much done there.
Yeah.
You mentioned topical, and I have not heard of this,
Yeah.
so I must be
So
slacking.
there's cosmetic, which actually is injections. You can inject it into wrinkles, into scars. You can do hair regeneration with it as well. Those you're injecting it twice a week for usually about 6 to 8 weeks with low dose ozone. And what it does, it stimulates blood flow. It stimulates a little bit of collagen production, so it's trying to restore the skin. Or for hair, trying to restore blood flow to the follicles. And then there's straight topical, which is where you make ozone oil. You take ozone, you mix it with a carrier oil, coconut not coconut, olive oil or hemp oil. Hemp oil is actually the best. It's just more expensive. It only lasts 3 weeks, no matter what you bind it with. It doesn't matter. And then you can apply it. So the main things I apply for are cosmetic issues for the face. Helps basically look younger. It's a really good anti-aging one. And then the other thing I use it for often is like fungal nail infections. You just put it on every day. It still takes like 6 to 8 weeks, but at least you're using a natural something instead of antifungal topicals.
Yeah.
And then you
Okay.
can
Well,
also
that's
do it
pretty
into
neat.
ears for chronic ear issues.
Huh. Yeah, that's a whole new world for me. Although it makes sense because when it comes to biohacking, I'm the furthest down my. I have all kinds of health things I'm working on, but the furthest down my list is aesthetics.
Hmm.
So I haven't really gotten into that world. Although you do quite a bit of aesthetics and things like that in your practice, right?
We do a bit of it, yeah. I mean, the trade name for it, not that I have the license to say it personally, is the vampire facelift. But that's just PRP or stem cells or ozone. You're just trying to wrinkle scars, microneedling with PRP and stem cells. Can't microneedle with ozone, wouldn't work too well.
Gotcha. So we didn't mention ozone injections at all, and I believe that's a thing. I think you call it Prolozone,
We
something
do
like that.
Prolozone, yep. So there's 2 ways to do Prolozone injections. There's you can either inject straight ozone gas, or you can inject. I know people mix the ozone gas with like dextrose to make That's true Prolozone, I suppose, because it's Prolotherapy, which is dextrose injections combined with ozone. And what that does, when you inject ozone into a joint, or unless you're really experienced with it, I don't recommend tendon or ligament injections with ozone, just because it hurts so much. So we don't numb up really well. But basically, it hyperoxygenates the area. So trying to increase blood flow, increase healing factors, stuff like that. I don't often do Prolozone by itself. I haven't found it to be as effective as Prolotherapy. It's good at reducing inflammation, but if you're looking for long-term healing, I'd rather you do Prolotherapy than Prolozone. I often will just do Prolozone or ozone injections first, wait about 10 minutes, and then do the PRP or the stem cells. It provides a good seeding ground for the injections.
Gotcha. And we're going to have a whole episode on like regenerative injections and how we can approach that. PRP, probably a whole episode. Stem cells, probably a whole episode. So those will be coming down the pipeline. Ozone, did we miss anything?
We covered benefits. We covered ways to do it. We covered detox effects,
Cost.
Yeah. I think that's pretty much it.
I think we nailed it.
Yeah.
Yeah. And you will hear a bit more about ozone. We're going to do another EBOO episode whenever I get back down to Florida, see Dr. K. And you'll probably hear more about it when we do our episode on mold and mold remediation. So we'll talk about it there a little bit more. So it's going to be a reoccurring effect. And I'm sure you'll hear a bit from me about my experimentations with it.
We look forward
to Dr. K. It was good to talk to you. And signing off, this is Coach Kyle. You can find me at ToxinFreeKyle on Instagram.
And this is Dr. K, or the OsteoDoc on Instagram. Thanks everybody for listening, and we'll see you next time.
Thank you guys.